like to welcome like to welcome Honorable Fenice to start us off with her opening remarks.
Chairperson of the Portfolio Committee on Health, Honorable Faith Mtambi, honorable members, colleagues from the research unit, guests and friends joining us today. Good morning and a warm welcome to each and everyone on the platform. A special welcome to our two presenters. A special thank you for the chance to open this important conversation on protecting and advancing SRHR in the face of the climate crisis. I'm grateful to the organizers and to everyone who's taken time to be part of this webinar. Before we dive into the policy detail, I want to share a quick personal reflection from our February oversight visit to Limpopo after the floods. Seeing those communities in person made something very clear. The climate crisis isn't a distant deadline. It shows up at clinic doors, on dirt roads, and in schoolyards. On the visit, we saw roads and bridges wash away, families displaced into crowded temporary shelters, and clinics struggling with water and power outages. Women told us about missed antenatal visits before transport was unsafe or unavailable, because transport was unsafe or unavailable. Some shared heartbreaking stories of deliveries at home after referrals could not be completed. Supply chains were disrupted, contraceptives and medicines were in short supply, and social protections that normally help people cope has been shredded. In this moment, you see how climate shocks quickly because sexual and reproductive health crisis. If I could sum up why this matters is in one short sentence, I borrowed this though. Climate shocks become health crises when our systems are unprepared. That's where rights, services, and resilience meet and when Parliament can make a real difference. A quick run through of the policy landscape we're working with. Climate policy and legislation. We have important building blocks. The 2011 National Climate Change Response White Paper sets a strategic direction. The 2019 National Climate Change Adaptation Strategy recognizes that women experience climate change differently and calls for gender responsive adaptation. The Climate Change Act 2024 create legal obligations for mitigations and adaptation and establishes a climate change response fund that could, if prioritized, support the health system resilience. Our second NDC 2025 signals intent to mainstream gender equity, but it doesn't yet give detailed guidance on health impacts on SRHR specific actions. SRHR policy and legislation. South Africa has strong frameworks, for example, the Choice on Termination of Pregnancy Act 1996, the Criminal Law Sexual Offences Act, the Children's Act, and strategic policies like the National Integrated SRHR Policy 2019 and the National Adolescent and Youth Health Policy. We also have the National Strategic Plan on Gender-Based Violence and Femicide 2020, which is critical in emergencies where gender-based violence risks rises. These laws and policies are progressive, but they often assume a functioning system. When climate shocks hit, those assumptions break down. So where are the gaps? Simply put, climate policies often recognize gender in principle, but they rarely spell out how to protect SRHR services during emergencies. Things like ensuring uninterrupted HIV treatment, keeping family planning supplies available, protecting access to emergency obstetric care, or embedding gender-based violence response into disaster planning and SRHR policies rarely anticipate the infrastructure, supply chain, and displacement challenges that come with extreme weather. What can we as Parliament do? Let me just indicate a few practical priorities. Insist that SRHR is mainstream into climate adaptation plans and NDC implementation with clear indicators and budget lines to these commitments aren't just words. Push for health-specific resilience measures in the Climate Change Response Fund, climate-proof clinics, reliable power and water for health facilities, secured supply chains for SRH commodities, and strengthen emergency referral systems. Demand better data, insist on gender and age disaggregated monitoring of climate impacts on SRHR so we can target responses and measures progress. Ensure gender-based violence prevention and response are part of disaster preparedness and relief. Safe spaces, clinical care, and psycho-social support must be planned and funded before emergencies happen. Use oversight and budgeting powers to make sure SRHR services remain accessible during and after climate events, and that affected communities, especially women, youth, and marginalized groups, are meaningfully involved in our planning. In conclusion, the floods we witnessed in Limpopo were a painful reminder that climate change magnifies existing inequalities. Women and girls and those with the least resources lose the most. But this is also a moment of opportunity. With the Climate Change Act and other policies now in place, we can insist on smarter right-based integration of SRHR into climate action. Honorable Chairperson, members, and each and every one on the platform. I look forward to the rest of this program to hear the evidence, the practical ideas from experts and communities, and to the tangible steps we can take in our legislative and oversight roles. So now it's my pleasure to introduce our first presenter, Professor Sibusiso Makwanansi. Professor Makwanansi is a senior researcher in the Climate and Health Cluster at the WITS Reproductive Health and HIV Institute, where her work sits at the intersection of climate, vulnerabilities, health systems, and populations dynamics, with a strong focus on reproductive health outcomes. She brings a practical, evidence-driven approach to translating research into policy and also serves as a national planning commissioner in the presidency, advising on climate change, development indicators, education, and health. Please join me in welcoming Professor Mkwananzi, who will share insights on how climate change is affecting SRHR and what policy responses are needed. Professor Mkwananzi, over to you.
Thank you so much. Thank you so much for this opportunity. And I'd like to greet everyone who has joined us today for this panel with all protocols observed. And I'm going to be speaking today on the threat of climate change to SRHR in South Africa and trying to really touch on proposed interventions as well as recommendations. So maybe just by way of introduction, I think all of us know that climate change is increasingly recognized as a critical public health and development challenge. And it really intersects with maternal health, healthcare access, and gender inequality, according to the WHO. And yet its implications for sexual and reproductive health and rights remain insufficiently firstly understood in many policy environments. And as a result, it is then not addressed when it comes to climate change policies. So globally, climate impacts are already measurable and visible. Firstly, we have extreme heat, where rising temperatures, increasing heat waves, and heat events are threatening vulnerable populations. We also have higher levels of severe flooding, such as the 2022 KwaZulu-Natal floods and the recent KwaZulu-Natal and Limpopo floods again, that have really devastated health infrastructure and communities. We are also experiencing prolonged droughts, which then undermine food security and livelihoods, and also deepen then socioeconomic vulnerability. And we're experiencing a lot of health system strain because of the pressures where we already have overstretched public health systems across the country, and then climate change impacts are making these even worse. So understanding these interactions is really essential for building climate resilient health systems, strengthening disaster preparedness, and safeguarding reproductive health services during climate shocks. I think it's also then important to zone in on the climate crisis that is happening in South Africa. It is real. We are experiencing a lot of significant climate shifts, variable rainfall, floods, and droughts, increasing air pollution, rising temperatures, and the heat waves are becoming more frequent and longer. And then, according to the CSIR in 2021, they projected that by 2050, average temperatures could increase by 2.5 degrees Celsius in South Africa. We would have higher levels of frequency of extreme heat waves projected to increase by 40%. And in coastal regions, they could see over 120 days above 30 degrees Celsius annually. So definitely South Africa is experiencing this climate crisis again. So what are sexual and reproductive health and rights? According to the UNFPA, sexual and reproductive health and rights encompass the fundamental entitlements of every individual to bodily autonomy, reproductive choice, and access to quality care, free from coercion, discrimination, as well as violence. And the core rights that are included in SRHR is making informed decisions about reproduction, having access to reproductive healthcare services, experiencing safe pregnancy and childbirth, accessing contraception and family planning, and living free from sexual and gender-based violence. The key services include antenatal and postnatal care, skilled birth attendance, family planning, counseling and provision, safe abortion services where it is legally permitted, as well as HIV and sexual transmitted infections prevention and treatment. And these services rely heavily on health systems being functional and infrastructure being stable, both of which then become vulnerable during climate hazards. So the pathways linking then climate change to SRHR is not just one pathway, but there are a couple of ways that climate change has now affected sexual and reproductive health and rights. Firstly, climate change is increasing the levels of infectious diseases. Flooding and extreme heat events have increased infections such as malaria, bilharzia, Rift Valley fever, as well as dengue. And these have adverse sexual and reproductive health consequences. As well, health infrastructure has been damaged quite a bit from flooding, storms, extreme heat events that end up disrupting clinics and maternity services. And then there are also maternal health risks, where heat exposure and food insecurity compound pregnancy complications. And the studies have even shown that there's increased risks of preterm births, as well as low birth weight of the babies. In terms of sexual and reproductive related health products, it's very important for us to understand that humidity and extreme heat events are affecting the stability of HIV health products, contraceptives, as well as other health products. International studies have already shown that health products could be affected by climate change. And studies need to be done now in South Africa and Africa as a whole to find out if we're experiencing the same challenges. But we probably are. Climate change has also led to reduced healthcare access where there's transport disruption and damaged road infrastructure, as Honorable said at the beginning. And this then delays access to antenatal care, increasing risk of adverse outcomes. Finally, protection and gender-based violence risks are also increased, where climate-related economic stress and displacement heighten the vulnerability to GBV and unintended pregnancy. Specifically, disaster management and SRHR is also quite related. In South Africa, the National Disaster Management Framework includes provisions for protecting vulnerable populations during disasters, but this does not explicitly integrate sexual and reproductive health and rights services into disaster preparedness protocols. So during disasters, humanitarian responses traditionally prioritize shelter, food, water, and emergency medical care. And this means reproductive health services during disasters may rely on operational decisions rather than formal policy guidance. 35 million of the 134 million people in need of humanitarian assistance are women and girls of reproductive age. And so reproductive health services remain essential during crises, where the UNFPA has stated that there's a minimal initial service package which outlines the global standards for reproductive health services during emergencies. And this package includes things like safe delivery services, emergency obstetric care, condoms, oral and injectable contraceptives, STI treatment, and services, of course, for survivors of sexual violence that normally increases during disasters. Specifically, I'd like to share two studies that we are conducting at SRHR, where we are looking at the effects of climate change and also possible interventions that could assist. Firstly, we have the heat adaptation for pregnant women and infants study. This study focuses on pregnant women and their infants in Tshwane informal settlements. We are using sensors, wearables, heat diaries, interviews to firstly look at heat exposure, where we have found that indoor heat temperatures go as high as 32.5 degrees Celsius, and they're even higher at times than outdoor temperatures. Particularly, masonry homes trap heat overnight, and lightweight structures heat quickly and also cool quickly. The health effects that we have found from this study is that pregnant women experience fatigue, heat strain, and poor sleep during heat events, and infants show irritability, breastfeeding sometimes is reduced. For social and structural constraints, there's a limited ability to alter housing in these communities, and rental and safety concerns also restrict ventilation and ability to alter their homes. So there also is overcrowding and lack of trees, which then worsen indoor heat. Finally, in terms of the community conditions, there's a lot of poor airflow, limited shading, and scarce water and electricity. The second study is the High Horizons Healthcare Worker Study, where we focus on the heat impacts of healthcare workers also in Tshwane. This study is a mixed method study where we are specifically looking at monitoring temperature as well as the heat effects and interventions in health facilities. The results from the first phase of the study, we saw that there's heat exposure differences by clinics and hospitals, where heat exposure is higher amongst clinics. And this heat exposure we saw causes fatigue, dehydration, and measurably reduced productivity amongst healthcare workers. We also saw that healthcare workers experience high levels of heat strain and heat strain symptoms, and also extreme heat affects quality of care. Then healthcare workers have limited coping strategies for the specific heat stress, and there's a high need for heat adaptation interventions in these spaces. And so interventions to prevent climate effects on SRHR really need to be a multi-level response. And so, for example, we need to have digital tools such as heat early warning and response systems, behavior change, where we could look at hydration promotion and guidance on avoiding outdoor heat exposure during peak hours. Health facility adaptation is really important, where we could think of ventilation improvements and indoor heat monitoring systems through thermal monitoring, for example. Built environment is also important, thinking of cool roof painting that we are doing at health facilities and in homes. And also we need to have more shade structures and more urban greening initiatives. Community engagement is very important to raise awareness, where heat education workshops as well as participatory methods to co-design the intervention solutions really needs to happen. Monitoring systems such as the wearable devices, temperature and humidity monitors, and biomarker surveillance could help us see how these various weather extreme events end up affecting health in different ways. And finally, we need to have policy integration. So things like heat health indicators need to be embedded in climate resilient PHC routine checks. Maternal care frameworks and occupational health and safety guidelines are also needed. And for example, in our healthcare worker study, we have already started piloting having occupational health and safety indicators included at the health facilities. So this integrated approach ensures that interventions operate at various levels, the individual, the facility, the community, and the policy simultaneously, and maximizing reach and resilience across the health system is then possible. At WITS RHI, we are testing climate adaptation interventions through these two studies. We are having heat early warning alerts, cool roof painting, facility cooling infrastructure through air conditioners, community water tanks we're going to be putting into the communities, the JoJo tanks. We are also ensuring that there's temperature monitoring, and that we've also put in something that we call a heat champion that is going to increase heat health training programs for SHE officers and healthcare workers to then strengthen local adaptive capacity. In terms of HAPPY, the study that is working with within communities for pregnant and postpartum women, we have handheld fans, we have desk fans, we've given them solar panels to be able to address to power the desktop fans. We have heat reflective paint that we have painted on the homes. We've given them umbrella hats, water bottles, and there's also the Mother Heat Alert app that they are working on. In communities, we are going to be putting in something called a cooling hub, which is an area that pregnant women and postpartum women and their children can come in and have a safe space, which is cool, that has water and teaching from a heat champion as well. We've given out cooling vests to community health workers for them to be cool during the day when they're in communities. We're going to be putting in JoJo tanks. We've planted trees in communities and health facilities. And then in the health facilities specifically, we've put in water dispensers, we've put in air conditioners, and again, we've put in heat champions who are then going to do the training for healthcare workers for them to understand the heat effects on health. And so a couple of recommendations for the target audience that we have today. I think it's important that Parliament knows that they play a critical role in enabling that climate change is addressed when it comes to sexual and reproductive health. Firstly, in terms of legislation, this is really the area where strengthening of legal and policy frameworks is going to be possible. We need to ensure explicit integration of sexual and reproductive health and rights within adaptation plans, within disaster management legislation and frameworks. We also need to strengthen provision for maternal health, contraception, HIV services, and GBV response with climate-related policies. We need to promote climate responsive health systems, and we need to protect the rights of pregnant women, adolescents, and other vulnerable or marginalized communities. In terms of oversight, parliamentarians really need to ensure accountability and implementation. So, monitoring how sexual and reproductive health and rights is incorporated into various policies, requesting regular reporting from departments, conducting oversight visits to areas affected by climate. I think you've already shown that you're already doing that, and that is very encouraging. And assessing coordination of disaster responses and sexual and reproductive health rights services provided. Budgeting, there also needs to be an allocation of resources for climate resilient sexual and reproductive health systems. So, you being able to advocate for dedicated funding towards climate resilient primary healthcare infrastructure is very important. Cooling interventions in maternity wards and clinics would also be helpful, and mobile sexual and reproductive health services, as well as health services in general during disasters, would be very useful. It is important to ensure budgets include the sexual and reproductive health minimal initial service package that I spoke about earlier. And we really need to ensure that you strengthen investments in heat early warning and response systems and community-based adaptation. So in terms of representation, parliamentarians really need to amplify their voices and raise awareness. It's important to elevate the link between climate change and sexual and reproductive health in debates as well as in communities. It's important to amplify the lived experiences of women living in informal settlements, pregnant women, young people, so all sorts of marginalized groups, vulnerabilized groups as well, and support inclusive participation of these groups in climate and health decision processes. In terms of evidence and coordination, supporting informed decision making through promoting the use of evidence from South African research, such as what we are doing at SRHR, remains very important. Encouraging integration of climate data with health data would be extremely helpful. Supporting interparliamentary collaboration across the SADC region on climate and health would also be important. As South Africa, we are doing much better in this area, but I think we could support other countries in the SADC region and across the continent, actually, in the sphere. It's also important then to strengthen alignment between health policy, climate policy, and disaster management systems, because working in silos really is not helping. Finally, again, intersectoral coordination is really important. So strengthening whole of government response to climate and SRH really becomes really, really vital. Promoting integrated planning across sectors by requiring coordinated action between health, the Department of Forestry and Fishing and Environment is really important, water and sanitation, human settlement, social development. All of these departments need to work together. We need to encourage the establishment or strengthening of interdepartmental task teams on climate and health, use parliamentary committees to facilitate joint briefings and accountability sessions, and ensure then that there is alignment between national, provincial, and municipal climate adaptation strategies and health service delivery and disaster response systems. So in conclusion, climate change is already affecting health risks in South Africa. I think, as you've all seen, reproductive health systems and pregnant women are particularly sensitive to these climate stresses. And while South Africa has incredibly strong and progressive climate and health policy frameworks, integration of SRH within climate adaptation and disaster governance remains incomplete. So climate shock adaptation would increase climate resilience for populations as well as the health sector. SRHR consideration for disaster governance would protect populations and prevent adverse effects of disasters. As with SRHI, we are doing a lot of research to generate evidence on how climate shocks affect maternal health and healthcare delivery. And also, we are ensuring that we see the effectiveness of interventions in our local settings in South Africa. And we would be happy to assist government and other stakeholders to also see if what are the other interventions that can assist, and also to implement some of these interventions that we have shown to be effective. And so strengthening sexual and reproductive health and rights integration could significantly improve health system resilience and protect maternal health during climate shocks. So with that, I'd like to acknowledge all of our partners, and here are my contact details. Thank you very much, ladies and gentlemen.
Thank you very much to Professor Mkwanazi for the informative presentation, as well as the clear recommendations you have indicated in the presentation.
Thank you.
We kindly request that all participants direct any questions or comments to the chat feature, where our presenters as well as the research unit will respond to your questions and comments. Our second presenter is Mr. Uday. Sorry for the pronunciation. He's a program specialist on climate adaptation and innovation at UNFPA's East and Southern Africa Regional Office. His regional work on climate adaptation through targeted projects supporting the development of nationally determined contributions and national adaptation plans, and advancing the integration of SRHR and gender in national climate policies. Previously, he served as a policy and advocacy analyst at UNFPA ESARO, where he focused on gender transformation, adaptation approaches. Please join me in welcoming Mr. Ode, who will speak on regional strategies for embedding SRHR in climate adaptation and resilience efforts. And when Mr. Ude is finished, Honorable Chairperson of the Portfolio Committee, Faith Mtambi, will take over when we go to questions and answers. Thank you very much. Over to you, Mr. Ude.
Thank you very much, Honorable, and good morning, everyone. It's great to be here and really to listen also to the presentation from the professor. I will try to go quickly and focus more on the policy side. Let me see if I can get my screen up. So if you can see my screen, I will be focusing around the integration of SRHR in climate change policies. And starting off, as already mentioned, I think in the introduction with the indices. So I would be focusing on the climate policies that South Africa has, and also perhaps would mention some of those that it does not have already, and which ones that present some key opportunities for strong integration. So first on the indices, which is the nationally determined contributions, these are policies that are submitted every 5 years. They are requirements of the Paris Agreement. As South Africa is a country that is signatory to the Paris Agreement, it is required to submit this document within the indicated timeline. So far, South Africa has submitted 2 of these. I think the last one was submitted last year. And also there was some significant level of public consultation within this process. The indices are typically supposed to have a strong national emission profile to show the level of emission of greenhouse gases, but also to indicate the planned actions for emission reductions, which in this case are mitigation targets. Also, the NDCs has increasingly included adaptation and resilience building segments in the document, especially from developing countries. They prioritize to ensure that these chapters are included in the NDC, as it has become a very strong a political document beyond not just nationally, but also at a global level that informs the international climate process. Typically, this process is led through the ministries of environment, depending on how a country is structured, is supported by the UN system and other development partners. The second one I would like to highlight is the National Adaptation Plan. This is a country-driven process. It is medium or long term. It has really a very substantial period of research and assessment that goes into it before it is fully developed. It is submitted largely by developing countries. The timelines are not the same as the NDC, and also they are not as immediate as the NDC. They are often aligned and mainstreamed in the NDC. Typically, for countries that have the NAPs, they're able to summarize it and put some of those content within the NDC. And South Africa also has a national adaptation plan. The other climate plans, there's the Climate Change and Gender Action Plan that South Africa is yet to finalize. I'm aware that they are currently developing this. There's also the long-term low emission development strategy that South Africa also has. This is to plan for 2050 and beyond. And then there's also the sectoral national adaptation plan. These are national adaptation plans that are more sectoral: health national adaptation plan, agricultural, fish, and you have, for coastal areas as well, you have many of them in that respect. So there's also some of these plans that countries do submit. At the moment, South Africa does not have the health national adaptation plan, which of course we will point out later in the slides. So at UNFPA, we do reviews of the climate policies to see how they integrate SRHR across the world. In our last review, we looked through 119 countries to see how they really reflect these intersections in their nationally determined contributions. In Africa, it was about 46 countries that we looked at to see how many of them were integrating these aspects of SRHR in the document. So this review covered NDCs that were submitted from 2020 to around August of 2022. And it followed the broad definition of SRHR. In this assessment, we explored references to SRHR, GBV, and harmful practices such as FGM, child marriage. But also, since we know that most of the NDCs are structured across various themes, we also included related areas such as health, gender, human rights, participation, and vulnerable groups, youth, population dynamics that includes migration and urbanization to ensure that the key entry points that SRHR could be integrated through are well covered. But for the purpose of this presentation, I will just focus on the SRHR mentioned. So as you see on the slide, from countries in Africa, you have about 17 mentions of SRHR, with maternal and newborn health being the highest, followed by gender-based violence. And then you have HIV and AIDS, especially for countries from the East and Southern African region. And then also there were some mentions around the family plan and contraception, and as well as adolescent SRHR, but also around sexual identities. There was no mention around menstrual hygiene, and then as well as around the early first and child marriage. In this assessment, we did not find any mentions in the South African NDC at that time. And I think Honorable did make mention in her opening speech around also safe abortion and contraceptives within this context. If you go to this tracker, you would see how the various countries have been aligned in their mentions. We try to show across region what countries are saying where and how, and also highlighting what we can consider a stronger integration of these aspects in those documents. So it's just to show some examples of what we saw from those NDCs that we call now NDC 2.0, those that were submitted between 2020 and 2022. You see, for example, how South Sudan has talked about integration of maternal health in their document, and Guinea as well. And we categorize this under national circumstances. I'm going to explain this a lot later in the slide. But also, we try to find which countries are proposing key interventions from those assessments. And you could find also Seychelles and Tunisia show us some example around this. But it's also important to know how these are measured. So how a country is giving or showing their indicators to measure implementation of this. And what we can consider an indicator was found only in the Papua New Guinea document at this time. From these findings, we saw that we needed better data and evidence, and in this case, national level data and evidence. I think South Africa is one country that is doing quite well in this regard. Of course, there's still a lot of room to improve. There's still many gaps, but compared to other countries in the continent, there's quite a substantial amount of evidence in South Africa to already get us started while we enhance those. There's also the component of vulnerability assessment. So increasingly, we need to have climate vulnerability assessments that integrate SRHR and that provide requisite indicators for countries to know how to address the gaps and what exactly to measure. I think the point about financing has been made, and I would emphasize this later. Also, similarly, the point on representation and ensuring human rights-based approach that leaves no one behind. I will also speak to the point about respecting the principles of the International Conference on Population and Development, especially the programming of action that include the protection of rights of women, children, refugees, displaced people, and people living with disability in this context. So when we have a look at the key climate policies of South Africa that are existing at the moment, we'll try to talk through the NDC and the National Adaptation Plan, but also the Biannual Transparency Report. So from what we found from the South African document, you can see in the latest NDC of South Africa that was submitted in October of 2025, there is some level of integration of SRHR in that document. As you can see on the slide, it highlighted pregnant women as vulnerable group, and also highlighted the importance of meeting daily nutritional requirements, which could have an impact on maternal health outcomes. It also addressed this under the loss and damage within the circumstances in South Africa. And as countries are increasingly highlighting their approach to loss and damage, it's important that key vulnerabilities are highlighted, as in the case with the South African NDC, especially highlighting pregnant women, the elderly, and children under 5 as particularly exposed. And then in the South African National Adaptation Plan, the only mention was around HIV and AIDS and in relation to adaptive capacity. And quite interestingly, in South Africa's Biannual Transparency Report, we find the mention of GBV in that document. It did mention how women also face heightened risk of gender-based violence, but also how this is linked to reduced access to resources and health impacts as well. What is interesting here is that the BTR, the Biannual Transparency Report, is supposed to reflect what the countries are doing in the implementation of their key national climate policies. And why we did not find the GBV in the national climate policies of South Africa, it's interesting to note also that the countries acknowledging this in the BTR, but it's important that they're able to sync these documents together to ensure a comprehensive integration across board. From these documents, we try to highlight perhaps what could be a potential entry point, because what we saw on the other side were not necessarily intervention-based approach. So here, when you find in the South African NDC some possible entry points of engagement, for example, on goal 2, where it talks about enhancing the disaster risk management, healthcare and sanitation provision, and considering to reduce impact of flooding and heat stress on most vulnerable households. So since already the vulnerable households were already highlighted to include pregnant women, the elderly, and the rest, this action point can be linked to that as an intervention measure. On goal 5, on as intervention, you have to train community leaders in climate information and interpretation, which is socially inclusive and gender responsive. Within the National Adaptation Plan, it does aim to identify individuals, male and female, and communities that are most at risk. It is also looking to equip and capacitate healthcare facilities, and also really looking to build capacity for the public and knowledge, especially of vulnerable groups. So what is important to note is that these are there, provide some entry points for engagement and implementation, but how far have we gone in delivering on this as well? In terms of critical gaps within the South African climate policy documents, we find, for example, in the integration failures, dimensions of SRHR and HIV and AIDS in the NDC and NAPS are limited to vulnerability levels. They lack substantial interventions unless you link, as we have done just in the previous slide. So it's important to have in the climate policies very clear and compelling integrations as various layers. I will show in subsequent slides how this can be done. There was no mention of this in the long-term low emission strategy, even though this is, and as well as the Climate Change Act, even though the LT-LEDs are heavy on mitigation, this also should be the reflection of gender responsive measures in this document. On GBV, and I think GBV in South Africa is also omitted from the key climate policy documents, except the mention in the BTRs as highlighted. Given the emergency status of this, a national emergency status of this in South Africa and growing evidence linking it, it should actually be reflected in the climate policy. Around maternal health and research gaps, the South Africa leads the regional climate and SRHR research, really, especially with the institutions you have, as you've seen also from the presentation from Professor earlier. So the climate policies are expected to have compelling and comprehensive integration of SRHR to building on all of these evidences that are emanating from the country. And I think the absence of menstrual health management and hygiene in this case highlights quite a significant gap. It's been mentioned already, the finance bit, they talk to lack of budgetary provision for climate and SRHR implementation, and this is considered a missed opportunity. And we are waiting the climate change and gender action plan, hopefully soon from the ministry. I think we understand it's been finalized, and hopefully this can further reflect some of the gaps that further integrate or close some of the gaps that we have highlighted here, and we also have been part of that process. So just to help to perhaps present an idea of how we can address some of the highlighted gaps, first, to ensure that our climate policies are strongly integrating some of these intersections, we have highlighted a criteria, a checklist to understand how we can ensure that they are robust. The climate policies are structured in specific ways. It has many sections, and most of them, you would find them written in this way. First, you will find a section on national circumstances that details the impact and vulnerability levels of the population and areas in the country. Second, it proposes intervention. So since it's shown the impact and the vulnerability levels, it will show what are we going to do to address these gaps. And from there, it's important then to see that you have budgets to be able to address actually the gaps that has been highlighted. And in this case, is to have gender responsive budgets that includes SRHR. And then we need to be able to have indicators to be able to measure these actions and interventions that we are proposing. Of course, it's very important that we have a participatory approach and consultation for this purpose, where also the Parliament can play a strong role. but also to ensure that other means of implementation and collaboration are present, especially interministerial coordination, importance of technology where possible, but also South-South cooperation where it can be leveraged. And in practical measures, I'll not spend much on this slide, but this steps shows you how you can go from the first step of preparing for key climate policy documents to the last step to ensure that all of the key components are well mainstreamed and the key stakeholders, and especially the identified vulnerable groups, are well involved in the process. And if you want to be able to know where to start, especially for a country like South Africa, that has quite a number of these policies, it's important to understand if SRHR and GBV are already integrated in any of this. If they are, the steps that are listed here will guide you on which approach to take. So if the integrations are substantial, you have a step to take to go about that. If they are not substantial, you also have another step to take to go about that. If they're existing in another policy in a substantial way, of course, there's no need to duplicate. You can simply replicate the same thing to make to in the other policy that is being updated and maybe strengthen it a bit with new evidence to ensure that all of the policies are robust enough. And then for each of the checklist, for example, we've prepared key questions to guide you to help you make the determination whether this component of the checklist is fully covered. For example, on national circumstances, we've listed some questions that you could ask in this regards to help provide some guidance on whether this document is robust or not. We have similar questions also for on interventions. You want to ask if the interventions are clear enough, are they substantive enough, are they proactive and long-term, do they have clear, are they clear, measurable, and result-oriented, and are they also transformative in the way that they strengthen or enhance the adaptive capacity of the population or the target group. Similarly, around budget integration, I think this has been a key one for us that we've mentioned repeatedly. In the climate document, you will find that for those that have budget, the budgets could be conditional or unconditional. It's important to reflect the SRHR and climate integrations on both sides. The conditional ones are the ones that the country is saying we can implement this provided we have resources from multilateral climate fund or external resources. When it's unconditional, it basically comes largely from the domestic financing. And then also checklist for indicators to consider if the indicators are smart. Are they disaggregated? Are they exclusively or primarily pertinent to women, girls, and gender diverse people? Are they targeted at outcomes? And how do they reflect very key issues that we are looking at? We also look at the levels of the indicator targeting. Are they national, subnational, or international? I think now that we have some of the outcomes from the key global processes, for example, the global goal on adaptation, for example, it has some indicators that are relevant. Maybe South Africa would be looking to implement some of those indicators to domesticate them to ensure they are aligned with the overall goal of climate adaptation at a global level. And also around consultation and validation, ensuring the meaningful engagement of key stakeholders in the process and ensuring that their contributions are actually taken into meaningful account. One thing to highlight is that we've seen also, I think, in the first phase of the NDC, where some countries did make some integration of or some linkages of population, especially in relation to population growth and mitigation. And we always try to clarify the linkages across this to say that while we understand that the relationship between population and climate change is crucial in designing climate policies that protects people's rights, particularly their reproductive choices, population growth, especially in poorest countries where fertility rates are highest, is often attacked as the primary driver of climate change. But for us, this is not the case. So these assumptions must be treated with the major skepticism that they deserve, as we know, in fact, that the major drivers of climate change is the emission of greenhouse gases of the wealthiest countries with a higher per capita emission. So Even though people living in the poorest of countries have contributed the least, they still face the most severe impact of climate change and have the fewest resources to adapt. So we always try to emphasize to ensure that countries are aligning their policies in a human rights based approach that respects the rights of people in all times and in all places. For the NDC 3.0, so now the NDC 3.0 are the latest NDCs that have been submitted. We wanted to show you briefly just how some other countries are integrating SRHR in those documents, some also from the Southern and Eastern African region. For example, you see Somalia is looking to develop climate resilient health infrastructures that is accessible to all, including pregnant women, people with disabilities, and rural population. They also highlight gender-based violence and the access to essential services. In Nigeria, they are highlighting extending social protection to cover vulnerable groups that include pregnant women. In Angola, similarly, they're also looking at exposure to protection risks such as early marriage and gender-based violence. In Rwanda, they are looking to make a plan to integrate early warning system and GBV protocol into climate planning and also launch clean cooking initiative. They also have significant references around maternal and neonatal health. So what can the parliament do in all of this to further take us to the next step? I think it's important to ensure that climate policies are evidence-based, especially now that we've seen the documents that South Africa has. It's important to know where we have the gaps. So, for example, there's no health national adaptation plan yet in South Africa, and it may be an important document to develop and to be considered as such to ensure a more robust health sector response, especially with the findings that universities like WITS are finding on climate and health intersection. It would be important that such a document is developed and finalized, and that they integrate SRHR and GBV. Similarly, for the Gender Action Plan that is in the process to ensure that this document is robust, but also for future updates of the NDC and other critical climate policy document. This is critically important. Again, they point on public consultation for SRHR integration, both in the national climate policy, but also integration of climate change in the national SRHR policy has to be a two-way approach to ensure that all sides are completely covered. It's also important to support capacity building effort, especially as we've seen this reflected in the National Adaptation Plan is a key priority. So it's important to allocate resources to be able to deliver this. It's important, the domestic financing in this case is important to help also to unlock some other multilateral financing that would help achieve the key commitments of South Africa. And lastly, it's important that the government is able to align key reporting frameworks and to also implement key SADC decisions, such as the Decision 10 of the joint meeting of the SADC Ministers of Health, which happened earlier in the year, where they adopted the outcomes of the climate and SRHR endeavor that happened in Johannesburg last year. I think it was around August last year. It was done with key partners with SADC, UNFPA, IOM, other UN entities in that. And there's substantial recommendations that SADC has adopted. And it will be important that the Parliament looks towards supporting the implementation of this decision, as well as ensuring that frameworks such as the BTRs, the biannual transparency reports, and the contributions to the second global stocktake speaks to the national climate policies and vis-a-vis on SRHR and GBV. What else can the Parliament do? I think around the area of climate finance, because this is a key challenge for many countries. The demands that come at a national level are reflected at the multilateral process on climate change. And I think it's important that we're aware of this and that we see how the roles that we play at a national level, the advocacy that we do, the demands that we make, especially from the Parliament, how they can influence processes at a global level. So ensuring that SRHR is a priority for climate finance through the key demands that the country makes to multilateral climate funds, such as the Green Climate Fund, the Green Environmental Facility, the Adaptation Fund, and the Fund for Responding to Loss and Damage, All these requests are important to ensure that these funds are aware that SRHR and climate is a key demand from countries. So I think as much as we increase this demand from the national level, we will see the results coming through the multilateral climate system. It's also important to rectify any relevant treaties that trigger access to climate finance in this respect, and to also enable financial instruments that can help establish national, county, or provincial level climate funds, create favorable regulatory frameworks that support innovative financing, but also to ensure that the legal basis to attract and manage foreign climate investments are there to support very resilient and sustainable means of financing these actions. It's also important to scrutinize, as your role in the parliament, the budget allocation and holding accountable the relevant ministries for access and utilization of this multilateral climate funds, but also to ensure that they integrate SRHR and climate interventions. So when a project proposal has been approved by the GCF, we want to know how much of those projects is covering climate and SRHR aspects. In each of these funds, in each of the climate funds that we've highlighted, they have what we call the national implementing entities. This is for the adaptation fund, or what you call the direct access entities. This is for the GCF and the other mechanisms. These entities at the national level are the ones that are able to access this financing directly. They're able to submit their proposal and go to the board to defend them and be able to receive the financing to support this project. So it's important to scrutinize also and supervise the performance to ensure relevant alignment with SRHR and climate needs. And lastly, it's important to facilitate adequate domestic climate finance allocation to ensure that South Africa meets the various government climate commitments. I think yes, this is all that I have for today. Siyabonga, thank you.
Thank you so much for the presentation, Mr. Ude. And the presentation is well received. And I want to greet all the audience that is in our midst. I think I've been alerted that we are a bit behind time, but I'll try to make sure that we catch up on the lost time so that at least by 12:30 we are done with this seminar. Then we are in the Q&A session. I'm glad that the chat box was open for quite some time. I've seen some of the colleagues, they've been asking questions, and the panelists have been trying to respond to the questions via the chat. So what I will then therefore do is, for those that maybe to afford those that could want to raise something in plenary now, I'll see it by a show of hands. Yeah, I can see the list of attendees there. If you have got an opportunity to raise your hand, you can do so. Failing which, I can also in the meantime be engaging with the facilitators. I see the attendance list, but I don't think you have been. Have you been afforded the opportunity to raise a hand in the link? Or it's only via the chat? Yeah, it seems like there's no such opportunity. And then I'll then also propose that these presentations is maybe shared now through the chat, so that the colleagues and the members who are here and every attendee can have full access to the presentation, because some of the issues that the attendees but the participant might be having, they might be fully covered in the presentation. But having said that, I will then maybe try to ask questions to the presenters. I hope it will cater for some of you who were not able to write the question through the chats. The first one that I felt need to be addressed is the issue around with regard to the statement from commitment to measurable actions. And then to you, the panelists, what are the most critical practical steps required to ensure that the South Africa's climate commitments then translate into measurable SHR outcomes, particularly for maternal health, and adolescent health. Who's willing to take this one?
Okay, I can start off and then Prof can come in. I think thanks for the question, and I think this is quite important because this is where we are now, and I think this is also in the presentation where we've highlighted some areas where we have some commitments already in the documents in the national climate policies, and what is now remaining is to ensure that these commitments are now implemented. One way to do that is to be able to work with the government, the key government entities, to ensure that both domestic and international climate financing is allocated to implementing these interventions. There are many opportunities to be able to do this. In fact, I think it's important to know that South Africa, for example, has been quite successful in implementing a lot of mitigation measures to address emission at source, but also to address other components around that. But then on the adaptation side, there needs to be significant improvement in the amount of financing that comes to the country in this aspect, especially those that they access from the Green Climate Fund, from GEF, from Adaptation Fund, including also from the fund for responding to loss and damage, especially for a country on the coast that has many parts of the country on the coast. So it's important to be able to co-develop a pipeline of proposals that are specifically focused around SRHR and climate change that the government can then use to resource mobilize from the key climate funds, but also to ensure that we have an incentive system where the amount that is mobilized externally is also in some parts matched in percentages by the domestic financing to show the commitment level and the seriousness at which these interventions are taken. So a lot of collaboration needs to happen as we're here, which is doing great work with the research, the civil society organizations that are working on the ground. We need to come together and be able to work together and join proposals to be able to access this financing and be able also to deliver for the communities. But I must say that the financing is highly insufficient, both at the global scale and at the national scale, at the regional scale. Financing, climate financing that goes to gender responsive measures are less than 2.5%. And those that go to health sector, especially from the multilateral finance space, is about 0.5% of the global climate finance and architecture. So there's a severe gap in that respect that needs to be addressed. And I think we need to be able to start working in one direction and collaborating with each other to be able to address this. And if I may, I saw also another question that was addressed to me by Moses, if I can answer that as well. So this was actually about to explain how we provide support to countries who battle financial resources to augment their climate-related policies and also any penalties in this regard. I think what we do as a fundamental part of our support is to ensure first that we support countries in preparing their climate policies to integrate these aspects. Once this is done in a very substantial way, the next step is to work with the country then to prepare proposals that goes to the GCF, the Adaptation Fund, and all of these multilateral climate funds. And when we do this, this becomes where we have the opportunity to receive resources for the country to be able to implement. There are some obstacles in there in the sense that many countries, this is not the case in South Africa, many countries do not have a direct access entity. So they have to access from international entities. But South Africa does have, and this presents an opportunity where we can work together with the National Direct Access Entity of South Africa to prepare the relevant project proposals that goes to the climate financing outfits, and then we can be able to deliver on the commitments of the government. But at the same time, the commitments are not enough. They have to be strong, robust, and far-reaching in all of the key documents. I think we can strengthen this for sure, but we can already start from what we have at the moment. In terms of penalties, we don't have penalties in this regards. Countries are sovereign entities, so the climate policies, even though for example, the NDC is mandated, is still voluntary in the way that it's implemented.
Thank you, Mr. Ude. This one is directed to Professor Mkonazi. that it relates to the bridging policy and implementation gaps. I just want to understand from you, Prof, where are the biggest disconnects between the climate policy and the SRHR service delivery on the ground? And what are the specific interventions that will close those gaps within the next 2 to 3 years? Also linked to this question with regard to protecting a SRHR during climate shocks. You check based on the recent climate-related disasters in the country, what proven intervention can ensure continuity of the SRHR services, especially for women and girls during the and immediately after all these emergencies. It's loaded, eh?
Yeah, it's very
Over to
loaded.
you, Prof.
Thank you. Thank you so much. So I think, the question actually links back to the first question. I think that the first thing in bridging policy and implementation, more what we are definitely going to need more of in South Africa is increasing education and awareness amongst implementers, amongst government officials, amongst frontline workers, amongst healthcare workers, specifically because it is only when the relevant parties understand, first of all, how climate change has happened and why all of these things are happening, but then also how climate change actually affects health in different pathways, right? Dependent upon what climate change is actually directly affecting and how that then indirectly affects health in one way or the other. Those pathways need to be explained to people. People need to understand, particularly, I think, healthcare workers need to understand, pathophysiology, what is etiology, what causative agent actually links with something else for one thing, climate change, to end up causing health effects. And in the work that we have been doing, for example, at SRHR, something we have been doing is heat health awareness talks for healthcare workers to understand what are the actual medical pathways that extreme heat can end up affecting individuals' health. So the first thing is raising awareness and education. I think also in terms of, what are the specific interventions that are needed? As much as we have tested various interventions in the communities that we are working in, we have tested these interventions, we have established their effectiveness. But to develop the interventions in the first place, we went through a co-development process with the relevant stakeholders, so with communities and with healthcare workers. And that process was very eye-opening for us to see that solutions that we thought were effective, had worked in certain contexts overseas, we thought they would work in South Africa, but we found that different communities and different settings have their own needs and have their own specific complexities that need them to be involved when we are creating these interventions and adaptation solutions. So because of that, I would really suggest that there are a number of interventions that can be put in place, right from some of the things that I shared at individual level, household, community level, facility level, and then policy level. But all of those things will have to be really developed and brainstormed, let me say, with communities, so that communities can come on board and embrace them, but also communities can tell us what do they think will work in their communities as opposed to others? And we can definitely assist in facilitation of that process. What I'm saying is that there is not a one size fits all type of solution, but there are different levels of solutions that can be tried and tested in different settings. Thank you so much.
Yeah, that's a mouthful, and I'm glad that you have emphasized the issue that we need to target the most vulnerable members of society. Yeah, because of the time issue, I think we'll have to end it here. And as I do that, but you have left here details. Participants are free to further send questions to your good selves. And then and this presentation that you have presented, they are going to be shared. And I think this is the engagement that we need to continue to engage on the matter. More so, they have been all your presentations have got recommendations. So it's up to us also as members of parliament and our support staff. How do we then take these matters forward? But I think that there's a limited time. These are matters that I think we need some hours to engage on. Yeah, we'll definitely take the metaphor forward and then maybe break them into components so that we are focused. We deal them with one by one. Having said that, under the circumstances, because of the time constraint, I would like now to hand over to the rapporteur from the research unit, Ms. Hannah Volpe, to just quickly deal with the summary of the recommendation for us as members of parliament. I think she should, yeah. Over to you, Hannah.
Thank you. My name is Hannah Wolpe, and I am representing the Parliamentary Research Unit today. I am actually employed as a research and project officer working specifically on sexual and reproductive health and rights at Parliament. And this is part of a broader regional project run by the SADC Parliamentary Forum. One of the specific focal areas is exactly this, SRHR and climate change, hence the webinar today. But we will be having future engagements on different elements of SRHR in the coming months, so we encourage you to keep an eye out for that. I'd like to thank all the speakers we had today, our chairpersons, our experts, and for all the engagement that we've had in the chat today from the audience. There will be a comprehensive report produced by the Parliamentary Research Unit providing some background, an overview of the policy, and a summary of all the recommendations made today. But for now, I'd just like to quickly distill some of these recommendations so that as we wind down for the day, we have them top of mind going forward. So firstly, it's this focus on integrating the legal and policy frameworks between climate change and SRHR to make sure that these are robustly integrated, they're evidence-based, and that we look at developing a health national adaptation plan specifically in future. We need to look at legislation that enables a health system which is climate responsive, and that includes some of the interventions we've learned about today. And that the legislation focuses specifically on protecting vulnerable populations, such as pregnant women, adolescents, and children. And then Parliament plays, of course, a huge role in oversight of these efforts. They can monitor the implementation of these climate commitments, request regular reports from departments on how ready their high-risk districts are, and whether essential SRHR services will be continued during climate shocks. Oversight visits can still be conducted to these affected areas for committees to assess the coordination of disaster response and whether the services are being provided as intended. And then this interdepartmental coordination is so essential given how cross-cutting these issues are. Parliament can promote this by holding joint briefings and accountability sessions. So looking now at that issue of finance, which Mr. Ude has highlighted as a critical gap, Parliament needs to make sure that there is adequate financing to meet these commitments and that they're not just a theoretical commitment. We need to make sure that the integrations of SRHR are also financed and budgeted for. There needs to be investment into these early warning and response systems and these interventions which help communities adapt to the climate crisis. And the climate resilient healthcare that we've also been learning about, including mobile SRHR services, which are able to take services to the communities when these communities are cut off from accessing the services themselves due to climate disasters. Then there is also this concept of the SRHR minimum initial services package that Professor was telling us about. This should be investigated and promoted as part of our disaster response strategy. And then these international climate funds that Mr. Chiyogozi was discussing, we should make sure that SRHR is prioritized in the finance South Africa receives, and that the financing is transparent and well aligned with our actual local needs. Budget allocations should be scrutinized by Parliament, and ministries need to be held accountable for the correct utilization of these funds. As we have also highlighted, this is, of course, not just an issue for South Africa. It is global, it is regional, and we need to be able to collaborate with other governments and countries in order to have a unified, more powerful response. So interparliamentary collaboration across the Southern Africa region, the SADC region, is essential, and we need to look at integrating, or rather aligning, our policy with these broader commitments. And then we need to just in general ensure that this issue of SRHR and climate change is elevated in the public consciousness through parliamentary debates and committee meetings, and that these conversations are including the voices of vulnerable populations and the people who are, at the end of the day, most affected by climate change. Lastly, we need to call for improved evidence to ensure that decision-making is well backed up by research. And this will include making sure climate and health research is integrated, they're not just researched in silos, and that data is disaggregated according to gender so that different gendered effects can be identified. Parliament can also then ensure that this high quality local data is used going forward in decision making. Just to wrap up here, I will post a link in the chat as well, or you can scan this with your phones. But if everyone in the chat could please just take 5 minutes of their time, we would really appreciate it if you could provide some feedback on the value or lack thereof of this webinar, and providing suggestions for how we can improve engagements in future, including suggestions you may have for follow-up events on related topics. Like I mentioned, there will be a report circulated within Parliament for this webinar, but if you are someone joining from outside of Parliament and you would like a copy of this report, you're welcome to email me on the email address displayed here, and I will be sure to share that with you. All right, that's it from me. I'd like to hand back to Honorable Mutambi for the closing remarks. Thank you.
Thank you so much, Anna. And then I think we want to thank our distinguished guests. When we started this session, we had over 41 attendees, and we cannot take this for granted, especially on a Friday afternoon where everyone is moving around. And then also to thank our colleagues, the members of Parliament, including our esteemed keynote speakers. I think I want to also express my sincere appreciation to Honorable Finis for your thoughtful opening remarks and for setting the tone for today's discussions. Her reflection, particularly on our recent oversight visit to Mpumalanga and Limpopo, have reminded us that the issues we are discussing today are not abstract policy debates, but lived realities affecting communities across our country. I would also like to extend our gratitude to Professor Mkwanazi and Mr. Ude for their valuable contribution. Your presentations have provided us with the evidence and policy perspectives necessary to move this discussion beyond concern and towards coordinated action. One message from today's dialogue stands out clearly, that climate change is not gender neutral, which compels us to design these responses that are explicitly gender responsive, targeted, and equitable. The discussions have also highlighted how the escalating climate crisis is already eroding progress in sexual and reproductive health and rights. The evidence shared on the physiological vulnerabilities of pregnant women, particularly the risk associated with heat stress and food insecurity, reminds us that climate change has a direct and profound implication for maternal and reproductive health. This reality, therefore, colleagues, places an important responsibility on all of us as policymakers. Our health system must become more resilient and responsive to climate-related pressures. We cannot allow the progress achieved through the National Integrated SRHR policy to be undermined by the environmental shocks and growing inequality. As representatives of the people, our mandate is clear. We must ensure that the Climate Change Act of 2024 and our national climate commitments translate into meaningful action. Our oversight must ensure that the climate financing mechanisms, including the Climate Change Response Fund and our national health budget, prioritize sexual and reproductive health as a core component of the climate adaptation. This therefore requires action on several fronts. I'll indicate first through legislation. We must continue strengthening the integration of the SRHR within climate response health systems planning. Secondly, through oversight, we must monitor the implementation of gender responsive climate intervention and ensure that the principle of a just transition translates into real opportunities, safety, and dignity for women. Thirdly, through budgeting, we must direct resources towards resilient health infrastructure and make sure that emergency and disaster responses always include essential SRHR services. In closing, let us take the key insights from today's discussion with us: the need for gender disaggregated data, the importance of youth-friendly health services in context of displacement, and the value of intergovernmental cooperation are all critical areas that require sustained attention by us as members of Parliament. I will then say to you, all of you, that a final report capturing the knowledge shared and recommendation emerging from today's webinar will be compiled by the research unit, and it will therefore be circulated to all of you who have been participants. Thank you for your active participation through the chat and your inputs, and for your continued commitment to protecting the health, dignity, and the rights of all South Africans. I now want to formally adjourn this webinar and thank once more for your attendance. Thank you and enjoy the rest of your afternoon.
Thank you, Chairperson.
Thank you.